Respiratory therapy, Lesson 10, Non-invasive positive pressure ventilation, NPPV. This unit covers the basics of respiratory therapy. The goal for this lesson is to understand what NPPV is and the indications for NPPV, and to learn about advantages and disadvantages of NPPV. This is the content of this lesson. NPPV refers to non-invasive positive pressure ventilation therapy, which mainly represents mechanical ventilation using a mask. Non-invasive ventilation for children is also referred to as NPPV. The purpose of NPPV is to improve non-uniform ventilation, blood flow and oxygenation, and reduce respiratory workload by expanding collapsed alveoli and decreasing intrapulmonary shunts through positive pressure of mask ventilation. Why is NPPV needed instead of intubation such as IPPV? NPPV prevents airway injury and vocal cord edema because it does not require intubation. Also, a non-invasive ventilation mask is easy to put on and off, so it can improve patients' quality of life as they have no problem communicating and drinking water. Compared to oxygen therapy and high-flow therapy, NPPV has advantages such as stable oxygen supply and therapeutic effect, which makes it the treatment of choice. Then, in what kind of patients can NPPV be used? There are many indications in the guidelines, but to summarize them, NPPV is indicated for the patients as listed in the slide. In clinical practice, there are patients who are at risk if they are shifted to intubation management, and it may also be used to improve recovery prior to the use of a ventilator. For cardiogenic pulmonary edema, NPPV use is recommended based on evidence. The advantages of NPPV are less pain for the patient, minimal use of sedatives, ability to communicate and intake orally. These are all considered to be advantages of not intubating, leading to improved quality of life. It is important to note that unreasonable use of NPPV to keep avoiding intubation may lead to worsening the patient's condition. If necessary, transition to intubation management should be done at the right time. The disadvantages of NPPV are as listed in the slide. The most important thing in performing NPPV is the patient's understanding about the treatment and the proper management while performing NPPV. Also, thorough explanation to the patient and management, including mask fitting, are the factors that bring out the effects of the treatment. This is the end of Lesson 10, Non-invasive positive pressure ventilation, NPPV. Make sure you've mastered the basic concepts before you move on to the next level.